Welcome back. Infectious disease specialist Dr. Zain Chagla joins us with a COVID-19 update. Good morning.
Hi, good morning, Bob.
Good to see you. So this morning in the news, we're expecting some new guidance regarding fourth booster shots for the elderly now, which seems reasonable enough, but I'm sure you're going to say they need to stop there, though, with the fourth dose.
Yeah, look, I mean, I think there's something to be said about picking populations that are at higher risk and giving them all the protections possible.
Yeah,
And
immunocompromised as well.
Yeah, exactly. And I think, you have an age group, say, over the age of 70 who may benefit from this. But we always still have to look back and talk about the people that haven't gotten first doses yet. And that's locally, but that's internationally as well. And even in the context of boosters coming out, we vaccinated more of the developing world, but have not necessarily even, scratched the surface in terms of getting them fully vaccinated with 3 doses. And so, there's definitely work to be done, outside of Canada. But that being said, as long as we go along this pathway, making sure that the right populations are getting the appropriate vaccine strategy rather than making a global vaccine strategy for everyone, I think we're going to be at least more reasonable and more sustainable in the long term.
Yeah. So I guess the latest wastewater collection samples show that the bump that we're seeing. Are we officially in a spring 6th wave?
Yeah, look, there is more transmission than a few weeks ago. I think everyone knows, even in healthcare, we have more healthcare workers out than we've had in the last few weeks. And so, there is something happening there. Our numbers, even the limited amount of testing in Ontario is up from 2 weeks ago. Every jurisdiction saw this. Some of this is BA2, some of this is the reduction in public health measures.
Right.
It really is, to be seen what that means. And so, the hope is here, as long as people are optimally immunized and whatever Omicron immunity is in the population, the healthcare impacts will hopefully be lessened with all of this. And it's important that people realize that there's still COVID out there and they have to judge their risk accordingly.
I want to get to this one that's been cropping up in the news a lot this week. A Canadian study, and it's making international headlines, shows someone probably contracted a highly mutated strain of COVID-19. And there's criticism that Canada is disorganized and underfunded in tracking wildlife. And also in another story, a Chinese city is actually culling indoor pets, which is unfortunate. But is there a serious concern about the COVID-19 or coronavirus mutating in animals and jumping back into the human population?
Yeah, absolutely. Look, this is a burdening field. I think we've realized a lot of animal vectors for this virus, house pets, in Hong Kong, there was a big transmission event with hamsters. In Ontario, we actually saw a whole lineage of COVID-19 that originated in deer. And some probable transmission that occurred to humans here, and it was actually the first described in the world. It is woefully underfunded, and as much as we talk about variants emerging from our population in terms of humans getting COVID-19, there may be something brewing in the animal kingdom that we don't even know about that can come back to humans at the end of the day. And so, it is important that this is funded, that monitoring, that surveillance in animals is just as important as humans, especially as we deal with this virus. But that article, really talks about how it's woefully underfunded now and really does need to be part of the pandemic strategy moving forward.
Yeah. Tell us about the work towards a pan-coronavirus vaccine. Is that even possible?
Yeah, absolutely. There's some phase 1 trials ongoing, including at McMaster, the inhaled vaccine trial using an element that's preserved. There's been actually a lot of work along finding antibodies to COVID-19 that are, to every COVID, SARS-CoV-1, SARS-CoV-2, and possibly to the next coronavirus. So, there is some of these targets being discovered. There's some phase 1 trials ongoing, both in Canada and the United States. And hopefully, that's the long-term solution here, right? As much as we, want to get through this pandemic, we know that coronaviruses have come out in the population and caused issues over the last 2 decades. This may be the big thing moving forward, is how do we get better immunity to coronaviruses? So even if we have one of these transmission events, we don't go into what we've gone through over the last 2 years.
Well, that would be a good thing, and we'll watch for the development of that and continue with our weekly chats. Infectious disease specialist, Dr. Zain Chagla. Have a great weekend.
You too. Take care.
All right.